I'm sure you will have been hearing quite a lot in the media and social channels about how the pandemic has put a spotlight on mental health like never before. There has been a surge of startling statistics revealing many people are dealing with some type of mental health issue as a result and are looking for support. The necessary changes that we've all seen to our daily lives has resulted in new and unfamiliar behavioural patterns. Whilst this has been essential, it will undoubtedly have consequences for people's mental health and well-being in the short term, but also in the long term, and perhaps particularly amongst those who are already living with conditions like anxiety, obsessive compulsive disorder and depression. So the challenges we're seeing at the moment, the calls into our Anytime Healthline, which is our nurse helpline service, have increased by 200% compared to the same time last year. And of those increased calls coming in, we're hearing increasing levels of fear, anxiety and depression in adults. Early studies out there show an increase in conditions such as loneliness and entrapment, and clearly research is needed to understand further the implication of these and to ensure that effective interventions can be made. COVID-19 is also hurting children's mental health. We know children thrive when they are safe and protected and community connections are stable. The outbreak is disrupting nearly every aspect of a child's life, their health, their learning, behaviour and their mental health. And we're seeing these trends confirmed in the calls that are coming into our family mental health line. There's been an increase in calls from parents seeking support and guidance whose children are self-harming, expressing suicidal thoughts, who are noticing more eating disorders. Whether this is something which families have been able to pick up on more since spending more time at home together is a possibility. However, regardless, it's a very worrying trend that we're seeing. As I mentioned earlier, there are two sides to every story, and the pandemic has also had a positive influence on mental health, for some. It has created more openness around mental health, propelling us faster than years of campaigning to break the stigma. We've seen mental health and well-being being equally talked about and recognised as important as physical health. What affects one affects the other. It's also important to understand the role digital support can now play. Perhaps people will feel more open to using remote tools and therapies for mental health in the future, including chatbots and remote virtual CBT. In summary, whilst the pandemic is likely to have a significant and lasting impact on people's mental health, more investment into mental health support will be needed to ensure that we can provide the support required in the post-COVID era.